It's more of a statement than a question, but I think it says, I still don't quite understand your job. So maybe you could give us like a high level what like a typical day looks like for you. And I know because you're faculty,
Right?
you do a lot of like teaching and research and things like that.
Yeah.
Maybe you could also compare it to like a previous position that you had.
Yeah, absolutely. So Carolyn was saying, more of a statement, like, let's clarify kind of what your job is. So I'm going to talk about the professor role and then the social work role. So for example, from the professor role, I teach the practice classes. So let's say, and this may fold over kind of into what we do as social workers. Okay, so let's say that I am an outpatient mental health therapist. Okay, so I have a kiddo that is saying to their parents, hey, I'm feeling depressed. So the parents say, okay, let me pick up the phone and see if there's somebody that you can talk to about the things that are going on in your world. So it's similar to a doctor's office, like you get an appointment with the therapist, which is the social worker, and so the social worker will sit down and talk to you, and they will say, like, what's going on? Tell me a little bit about yourself. And then we actually have this entire humongous book called the DSM, where we're able to diagnose people. So then, we'll give you a medical diagnosis of like depressive disorder, NOS. So as you're sitting down and talking to that social worker for the first time, that's my job as a professor, to be able to teach that new social worker how to talk to people. So we talk about things like eye contact, nonverbal communication. How do you explain to a client what you're going to talk to about in session? And I apologize because like the field of social work is so big. Like I was saying earlier, I currently still see some clients in private practice, so to do therapy with them. And that process, what it looks like is usually somebody else identifies that this client is struggling. So again, let's go back to depression. So maybe their doctor says, okay, you've been on a medication for depression. We want you to talk to somebody because you can't just take a pill and make everything go away. Mm-hmm. So then at that point, like, for example, today I just got another referral. So I get an email from a doctor and they say, hey, Megan, Lindsey, we need you to see so-and-so. They're saying that they're depressed. So I have all of their information. So I call them and I say, my name is Megan. Dr. So-and-so referred you. When would be a good time to meet? So then we literally, I say we just sit and talk, but then we get to talk. And then there are all kinds of strategies that we have been trained to do to be able to, work through some of the issues that our clients face on a daily basis.